Greetings and welcome to the introduction to the virtual tour of the Lurie Children's Pritzker Department of Psychiatry and Behavioral Health's new website for resources for advancing mental health in pediatrics, RAMP. This session is being recorded. My name is Chad Worley, your physician liaison for the City North and Northwest region, along with Paula Nowak, liaison for the City and South region, and Julie Kalkbrenner, liaison for the West region. We are joined by Dr. Rachel Ballard and Dr. John Parkhurst of the Lurie Children's Pritzker Department of Psychiatry and Behavioral Health. They will be your tour guide today for the RAMP website. But before we turn it over to them, we want to encourage you to have engagement through questions in our chat room and live Q&A after the tour. I'm sure after Dr. Ballard and Dr. Parkhurst take you through this great new website, that you'll have plenty of questions, but I'm sure you're going to enjoy this and be happy with the new resources that we are providing you. But enough of me talking. I'd like to turn it over to Dr. Ballard and Dr. John Parkhurst for your virtual tour, and enjoy your session, everybody.
Good morning.
Good morning, everybody.
So we have the pleasure today to talk about RAMP, or Resources in Advancing Mental Health Through Pediatrics. So Rachel and I, Rachel, a child psychiatrist and pediatrician, and myself, a psychologist, spent the last few years working through our collaborative care program, as many of you know, MAC, or Mood, Anxiety, ADHD Collaborative Care. And part of that effort has really been learning more about what our pediatricians, and I should also say in Rachel's ongoing work in the academic pediatrics clinic at Lurie, working with trainees as well. So part of that work really is thinking through how do we provide the best type of materials and content for pediatricians in the community, but also in our academic pediatrics clinics, and provide them resources around mental health topics. Obviously, it's been a hot topic over the last few years, and we're really excited to have pulled together all of this information. And really, it probably started with identifying the problem is there are resources out there, but they're not always where we want them or at our fingertips. So our goal here is to try and put these resources in one house. And in this website, and I think what you guys will see, and what our other effort has been as part of this, is to make sure that all of this material is accessible for everybody. So multiple ways of kind of engaging with the content, in addition to it being open source. So one of the things that also was a little bit vexing to us is that there might be mental health content or videos that have been very diligently created, but you might find them behind a paywall. And we felt that that was a little bit unfair for the overall mission of what we want to do, which is to make sure that everybody has access to mental health resources to make taking on potentially challenging or new mental health topics a little bit more accessible. So that is the big overview, but I'm going to pass it off to Rachel to really walk through the RAMP website, and she'll pull that up and bring us through that. Want to make sure we also have time for questions as well. So Rachel.
All right, super. Thank you, John. So this is the site. Everybody can see the screen? Excellent.
Yeah.
So the site is set up to be a place where you can go and look things up, and it also houses a complete curriculum. So when you come to our first page here, if you scroll down a little bit, you'll see the major sections of the website. There are mental health conditions, so essentially all of your diagnoses. There's a section called diverse populations, which covers the way that mental health affects different people in different ways. There's sections on treatments, medication treatments, and psychotherapy treatments. Our mental health toolbox, and I'm gonna pop through these, but I just want to give the big overview. The mental health toolbox includes a lot of strategies, things like screening, time management, and other tools. We have a section on parent and patient handouts. We have some videos, and then we have our curriculum, and I'll introduce you to the curriculum in a second. So the conditions include all the common conditions that you're frequently seeing in primary care up at the top: anxiety, depression, and ADHD. That's bread and butter pediatric mental health. Disruptive behavior disorders like ODD and conduct disorder follow quickly on the heels of these diagnoses. And then we have information on other conditions that you're likely to see that we don't expect that you're likely to be treating, but that it's really helpful to be aware of and be able to put into a framework of the big picture of mental health. And speaking of the framework, we have the framework kind of outlined here. This figure in the introduction to this section cues you into how these different conditions tend to emerge at pretty predictable times over the course of development. In our treatment section, we address psychotherapy treatments. You won't be doing psychotherapy, but your patients will be doing psychotherapy. So understanding what happens in psychotherapy and how you can tell if your patients are getting the most out of their psychotherapy treatments is part of your overall management. So this helps you understand psychotherapy. The medications help you address the key medications that you'll be using, which are mostly the SSRIs and then the ADHD medications. But we also have information on other medicines that you might not be prescribing often, but want to understand potential side effects, adverse effects, benefits, like the antipsychotics and some other medications. We cover, like I said, ideas about mental health and race and ethnicity, mental health and immigrants and refugees, and sexual and gender minority youth, medically ill children and adolescents, and kids with intellectual disabilities. In our mental health toolbox, we cover anticipatory guidance, screening and measurement, trauma-informed pediatric care, collaborative care, some information about common factors and time management. And finally, just things like the level of care and types of providers so that you understand the sort of the scope of mental health care and where your patients may be, at what points your patients may be accessing mental health care. All right, the fun stuff is over in videos and handouts. John and I worked with undergraduates from Northwestern to put together these handouts, and the students kind of came up with this format for us using a poster program. So we have these printable handouts. They look okay if you print them in black and white, but we loved the colors. And so these are handouts that you can give your patients. We have handouts for parents that are helping parents understand what their kids are going through. I was just working on updating the safety planning handout to include the new 988 line rather than the old suicide crisis line. So that will be updated shortly. And then this final section is a series of handouts on positive parenting, giving people some, little nuggets of parenting strategies. And then we collaborated with our marketing department friends and audiovisual people to make these videos. And we have some examples here of how to talk about prescribing SSRIs for depression or anxiety, how to talk about ADHD medications. We have a section on pill swallowing, and Dr. Susan Sirota models suicide assessment and safety planning in this video here.
Dr. Ballard,
yeah.
Dr. Ballard, I'm sorry, could you go back to the last page that you were on with the PDFs? And
Yeah.
can you show everybody that they're downloadable? Can you click on on the download
Oh,
PDF?
yeah. Yep.
Okay.
So here you go. So if you click on it, you can see it up closer. And then you can download it over here.
This, as Rachel was mentioning, building these 27 handouts was a real labor of love. But we really like the content, have gone over it, and actually had a subset of pediatricians review it and provide comments on it before we distributed it. So as I'm sure you'll see, what's been great about this website process is it really has brought together a lot of collaborators, both pediatricians in the community, our specialists internally at Lurie, and then also leveraging and working with students to kind of work on health promotion designs and that kind of good stuff. And so it feels pretty naturalistic to me in how this has come together, and also many avenues to continue to move forward. So I want to mention, Rachel, and then I'll stop talking. That within the site, as you guys are, as everybody's working through this, so it's pretty simple. It's just ramp.luriechildrens.org, and you can go in there and start noodling around and seeing what's available. Obviously there will be updates. There's also a search function within that site. So if there's anything specifically that you're looking for, you can click in the search button and that should pop up. So hopefully it's able to be used as a resource as you have a specific question and are looking for content around a specific diagnosis or topic. And Rachel, I'll stop talking and let you move forward.
Okay, yeah, the last thing I want to highlight before we open it up for questions is the curriculum, because everything that you've seen on the website so far is also, well, most of it is also included in the curriculum. So the curriculum is an adaptation of a curriculum that we built and had available for CME for our original MAC cohort. We have revamped them, re-recorded them, and they are all here in 2 forms. So the overall curriculum, I think, has 12 chapters. But it starts with a conceptual framework, covers anxiety and treatment, depression and treatment, 3 chapters on ADHD, and some additional psychopharm. Each of these things you can experience it as an audiovisual recording that walks you through it, or you can just download and read the same content. So all the content that's in the AV format is also available for you to kind of sit and read at your, however you like to learn. And then at the bottom of this page, we started working on special topics and brief lessons that cover frequently asked questions. And those are in the form of these mini lessons. So for example, when do you use a non-stimulant medication for ADHD? This is a little mini lesson. It's interactive. There's questions you can ask along the way, questions you can answer. And you can go through this in about four minutes or so, but it will help you. It will help you think about the use of non-stimulants and how to use them. So all that said, I think I'll leave the screen up so that we can move around, but let's open it up for questions.
Great, thank you. So feel free to raise your hand if you want to ask live, or type them up in the chat room if you have questions. One that just popped into me on a private chat was, thank you for providing this information. This is going to be a great resource for us. Can you let us know how often you plan on updating the material? Is it ongoing, or is it a yearly? Thank you again.
Yeah, there's a contact us page at the top. So if you have questions, if you have ideas, if there's a video you would like to see, if there's handouts or mini lessons that you would like to see, please write to us and we will work on them. We have, I think, hidden a section at the bottom of the first page that's going to be updates. So when we're adding new material, we'll highlight it in the section at the bottom. We haven't turned that on yet because there's nothing to put in it, but I think it definitely won't be something as scheduled as on an annual basis. We will review the material. We'll put ourselves in a standard review to make sure all the information stays up to date, but new stuff will pop up whenever we get to it.
That's great. Thank you. Next question.
Can I add a quick piece?
Yeah, please go ahead.
I think our hope would be to share that material as we update it. So finding the appropriate medium for that, whether that's kind of releasing through a social media channel. We haven't figured that piece out yet. I don't think anybody's figured out where they're at with Twitter right now. So we're waiting to see how the landscape falls. But we do have many. Rachel and I are constantly talking with other providers in our department about what types of videos and content might be relevant. So please, any ideas, please send them our way. We're happy to collaborate and think through what might be most useful for your team.
I will tell you that you're able to use your physician liaisons to distribute information if need be, as well as we are in contact with our PCP partners on a regular basis. So feel free to reach out to us, and we're happy to distribute as well. So the next question: will this curriculum replace the MAC curriculum, but still connect us to the Lurie Behavioral Health team?
Right now, I think this is going to be our better use of. This is our better platform for our content. Right now, the CMEs aren't active anymore through the Peach New Media site that many of you have kind of slogged through. The benefit was that Peach New Media and that platform for the MAC curriculum allowed us to track CMEs. We have found, at least recently, that CMEs is a little less valuable or less of a carrot than just being able to have access to MAC and the MAC team. So our plan is to continue to use this as the platform. If there is a growing demand of getting back to CME, that certainly is possible. But this current platform does not have the CME tracking. Has the ability, but we haven't turned it on yet. And we'd have to work through a couple of technical pieces there.
Excellent. Next one is thank you. The handouts are great. Is there a way to access these in Community Connect Epic so we can easily put them into an AVS for our patients? This was from Dr. Sirota.
That's the next step. We've definitely thought about that. I don't know who to ask about that. If anybody here knows who to ask about getting that a link built into Epic, we will talk to that person or entity.
Well, and certainly the links can be added directly. But I think it's a really good point, Dr. Sirota.
Dr. Sirota says that Dr. Gupa was able to do it with her peanut introduction food info.
Okay, so talk to Ruchi and the Epic team.
Got it.
Will there be an easy way to share these handouts with families through MyChart?
Similar question. I'm thinking through what it means to send an attachment. Yeah, the short answer is I don't.
We're working through the kinks.
How about that? I was going to say I don't think it's ever easy to send an attachment through MyChart. Although that's not true. I mean, our patient reported outcomes are teed up and,
Mhm,
you know, lined up to be able to attach and send out.
mhm,
But other attachments are a little bit trickier. So
mhm.
again, I appreciate that. And I think that's attached to the same question that
Okay.
we asked before, that you
I
just
fully,
asked.
I fully support everybody telling an epic person in their life that these need to be within my chart or in the ABS, because it takes me some effort to kind of push and nudge and kind of get some attention to because I think there are so many demands on our small, relatively small epic team. So it's and they work really hard and it worked really well for us, but it's I think that's a great point, and I think these should be a little bit more streamlined, especially as we move forward and we see people's usage of them.
And Dr. Joyce is asking, can you review again how to access the site?
Oh, yeah. So you can Google it now. If you just type ramp Lurie Children's, it'll come up. But the address is ramp.luriechildren's. So it's ramp.luriechildren's.org. That's all you need.
You are welcome to share this widely. There's again, part of the intention is that this is open access and open source. So this is free content for anybody who might be working through treating mental health concerns in primary care.
Well, right now we don't have any other questions. Julie, Paula, do you have anything for everybody?
Feel free to reach out to your liaisons if you have other questions. We'll make sure to get them back to Dr. Ballard and Dr. Parkhurst, and we will definitely look into accessing through Community Connect and MyChart and get those instructions back to you.
I just wanted to say thank you so much for offering this content and making it so easily available. It is easily available for even other support staff within your office too. So please use liberally, and we are very excited to be offering this to our community providers. Thank you.
Thank you. And Dr. Supple, no, you do not need to sign in. All you need to do is access, go to the link and access the site, and all your information is right there for you. So I'd just like to thank Dr. Ballard and Dr. Parkhurst, and of course, all of you for joining us today. Again, this was recorded and we will be sending this out to you so you can view again, or if you'd like to share with your colleagues. But again, thank you for being such a great partner with Lurie Children's. And again, reach out to myself, Julie, or Paula for any questions along the way. But with that said, have a happy Thanksgiving to everybody and enjoy your day.
Thank you all.
Thank you, Paul.